Hello everyone, I myself Akhila Maurya. I am working as a chief audiologist at Alekia ENT Care. Today I am going to talk about what is a hearing loss and what are the different types of hearing loss and how we diagnose the hearing loss and what are the treatment options available here. So coming to the hearing loss, first what is a hearing loss? Like hearing loss is the reduction of your ability to hear a normal sounds. So hearing loss can be identified by doing different kinds of tests. There will be a different test for the pediatrics, and there will be some different tests for the geriatrics as well. So coming to the test, there are two basic tests which we'll be doing to identify your hearing loss. First is a pure tone audiometry, which is a basic hearing test. So in this hearing test, how we will be doing is that we need a sound treated room for this test. So usually we put headphones to the patient and we'll be presenting a different kinds of sound to the patient, and we will be taking the response of the patient in this test. So with this test we will come to know the degree of the hearing loss, type of hearing loss, and the configuration of the hearing loss. So coming to another test, it is an impedance audiometry. The basic like why we do this impedance audiometry is that to identify the middle ear status, like is there any bone issues, is there any the function of the eustachian tube, and if there is any infection in the ear. So by all this, we will come to know with this test. And second foremost purpose is that we can even also see the acoustic reflex from the stapedial muscle in the middle ear. So these are the very basic two tests that we do to a person if a person is having a hearing loss. And after identifying the hearing loss and all, so based on the type of hearing loss, degree of hearing loss, the treatment options will be available. So these are the basic two tests which will be basically done for the geriatric population, adults. Coming to the babies, who are below 5 years, so we cannot do these test for the below 5 years because they cannot follow your instructions, and they cannot, as this test pure tone audiometry is a subjective test, so kids cannot follow your instructions and they may not be able to give you a proper response. So in this case, then what we can do, how we will identify a hearing loss in a babies, less than 5 years or newborns or something like that. So for that there is another test which we call as a brainstem evoked response audiometry. So in this test what we do is that we will be we will make the child to sleep, child should be slept, and there should not be any movement and all. And after that we will be placing the electrodes to the kid, and then we will present different kinds of sounds to the to the ears, and we will take the response directly from the brain, how the child is responding, how the child's brain is responding to the different kinds of sounds that we are presenting. So in this test we will come to know the hearing status, what at what level at what level the child is hearing and all, we will identify. So there is another test also which we usually do for the newborns, that is called autoacoustic emission. What is the importance of this test is that as soon as the baby is born, the hearing has to be tested whether the baby is hearing properly or not. So right after the birth, before the discharge from the hospital, we usually do this test, autoacoustic emissions. In this test we usually place a probe in the baby's ear, and we will present different sounds and we take the response from that. So with that we will come to know whether the child is able to respond or not. If not, there will be some criteria next what has to be done. So these are the very basic two tests which has been done for the children. Okay, so now the test has been done, and next coming to the treatment options. As now we have come to know the diagnosis and the degree, everything. So in the geriatrics, coming to the geriatrics, there are different types of hearing loss. So before going to another this thing, I would like to discuss the types of hearing loss also. So there are basically three types of hearing loss. One is a conductive hearing loss. Conductive hearing loss is usually caused by if there is any kind of infection in your ear, or any bone dislocations or discontinuity in your bones, or eustachian tube dysfunction. So anything which is related to outer ear and middle ear, usually the cause will be between these two, like outer ear or middle ear. So then in that cases we will usually see conductive hearing loss. Conductive hearing loss can be treated medically or surgically mostly. And next is a sensorineural hearing loss. So what is a sensorineural hearing loss? This is something related to your neural nerves are getting affected here. That's where you are not able to hear properly. It may be due to your auditory nerve damage or the hair cell damage. So mostly this is being seen in the geriatric population. This is called a age related loss. That the medical term is a presbycusis. So basically in this kind of hearing loss, there is no any medical or surgical procedures will help you out. You have to go for some external device that is called hearing aids. Hearing aids is nothing but it's an electronic device which can be worn in or outside your ear. Okay, so this is the treatment option for sensorineural hearing loss. So the third one is a mixed component, mixed hearing loss. That would be, there will be some component of conductive and a neural component. So accordingly we have to treat the hearing loss. So coming to the hearing, sensorineural hearing loss, as I said that there are different types of hearing aid. Before I mention what is a hearing aid, now I'll describe what are the styles and what are the models of the hearing aid. So there are basically 5 types of hearing aid. One is a BTE, that is called behind the ear. Second one is a RIC, receiver in the canal. Third is the CIC, completely in the canal. Fourth is a ITC, that is in the canal. And fifth is a IIC, that is completely in the canal. So these are the basic 5 types of hearing aids. So coming to how you will select a different styles of a hearing aid. So it is basically depends on the degree of your hearing loss and age also, and the lifestyle of the patient. So we will be, before giving a hearing aid, we will ask a different questions from the patient just to understand the lifestyle of the patient. What are the requirements? Because based on the requirements, based on the needs of the patient, we have to give a hearing aid. Because even in the hearing aids also, there are so many technology, like as all the hearing aids are digital now, there are so many levels, like just like in phones, you have a basic phone from it will go in lakhs, right? So same way in the hearing aids also, there are different kinds of hearing aid. There are different technologies, there is something called channels in the hearing aids, which starts from 2 channel, 4 channel, 6 channel, 8 channel, like that. So there are different variants in the hearing aids also. So you have to understand the lifestyle of the patient and needs of the patient. So according to the needs of the patient, you have to select your hearing aids. So for example, if you see a housewife needs are different from a person who is working in a office or something. If you're working in an office, you have a very active lifestyle than a housewife, right? So you have to select accordingly. It's not like for every person the one hearing aid will work. No, it won't work. So coming to the technology of the hearing aids, there are different kinds of technology now these days, you get a rechargeable hearing aids also, where you can connect your hearing aids with your smartphones, with your TV. So as the technology has been progressed now, like hearing aid companies have done a lot of research, and they are coming up with a very good technology where we can solve actually the problem of hearing loss. Due to the hearing loss, what happens, geriatric people, there will be a lot of communication breakdown, there will be lot of depression, that they cannot communicate with the family members itself. So to solve all these kinds of hearing challenges which are being faced, so they are coming up with a really good technology hearing aids. So before that, there was a myth that hearing aids are always noisy. When you wear a hearing aid, people will tell no, it creates a lot of noise and it creates a lot of uncomfortable. So now it is no more like that. Hearing aids are also being upgraded. There are a very good technology hearing aids. It's the only thing is that you have to just come out, get yourself tested, and visit an audiologist. He or she will guide you what kind of a hearing aid you require. So please get yourself tested, and if you are a candidate for a hearing aid, please go for a hearing aid and use it. Thank you so much.